Let's go back now to Lora, Windsor to hear how Waterlase is used for cosmetic procedures.
Thank you, Chris. Imagine scarless healing when having a mole and brown spot removed or other cosmetic procedures done. Plastic surgeon Dr. Douglas Hendricks talks about how using Waterlase on skin tissue can produce scarless results.
Waterlase very kindly contacted me, we met, and they asked me to see what this can do on the outside of the mouth, in the areas that are not dental. So I've basically used the laser from tip of the head to the bottom of the foot. It's an amazing tool. I don't know where I'd be without it. In Southern California, many people, most people over 50 years old have experienced at least one skin cancer. And to offer them an option besides making a big cut in the area, cutting out a football shape, bringing it together, leaving them a linear scar with railroad track marks on either side from the stitches, is a very attractive alternative. In fact, many people, I think, avoid asking doctors about excising an unsightly mole because they're concerned that the scar will be even more unsightly. And I can't just get the word out fast enough that I have an alternative to that that is safe, effective, and essentially scarless. This patient is a 43-year-old and came to me about a troublesome brown spot on his cheek. Fortunately, the Waterlase gives me the ability to treat this in a way that is not possible with any other device. With the Waterlase, there's a unique ability to treat spider veins. The BioLase specifically, because of its unique characteristics, I can treat the vein by bringing the laser very close to it, transmitting some of the heat without really a sensation to the patient of much heat. And that causes the vein to coagulate right there at that spot. And so what you're doing is creating dams all along with that spider vein with minimal trauma to the skin, keeping the skin cool with that water and air spray, so there's not thermal damage to the skin that would result in a noticeable scar. With the Waterlase, I've been able to do incisional surgery as well. I've done blepharoplasty surgery. As you may be aware, that's removing the extra skin and the underlying tissue. That it still requires some anesthesia. It's not completely eliminated the need for anesthesia, but I've been able to do that with very clear surgery. The laser will cauterize or coagulate the tiny little veins as I'm removing the skin or making a skin incision, and that makes the field very clear. It's very easy to see, and so that's been very beneficial as well. I've taken care of a diabetic foot ulcer, and one of my relatives that was completely down to the bone. I was just showing one of the gentlemen here that photograph, and after it's healed, I have a photograph of after it's healed, you can't even see a scar where this ulcer was, and it was right down to the bone. Every family get-together that we have, when we're standing around praying before the meal, he will also add, and thank you to Doug for helping save my foot. He's so grateful. He won't let anybody forget that.
The possibilities of using Waterlase for cosmetic procedures is endless and still evolving. We'll continue to follow this fascinating technology. For the American Health Journal, I'm Lora Windsor.